Hello everyone, my name is Kirti Sinha, student of second year B Physiotherapy, is here to explain you about the given topic, that is articulation of hip joint. So as we all know that the hip joint is a ball and socket synovial joint formed by the articulation between the pelvic acetabulum and the head of the femur. It forms a connection from the lower limb to the pelvic girdle and thus is designed for the stability and weight bearing rather than a large range of movement. So basically this articulation of the hip joint is formed by proximal articulation and the second, that is distal articulation, and proximal is formed by the acetabular bone and the distal articulatory bone is the head of the femur. So let us first see the proximal articulatory surface, that is acetabulum, which is formed by three bones, that is ischium, ilium and pubis. This acetabulum can be divided into lunate surface and acetabulum fossa. Now let us first look the features of the lunate surface. It has acetabular notch, transverse acetabular ligament which allow the blood to pass through it, and it also has a hyaline cartilage. And then going to the next part, that is acetabular fossa, do not have any cartilage. Instead of that, we have a fibroelastic fat and synovial membrane producing synovial fluid. Now talking about the labrum, that is present in the acetabulum, which is a fibrocartilaginous structure which is basically increase the depth of the acetabular bone, allowing the head of the femur to fit in it properly. Now it also helps in better lubrication because of high hydrostatic pressure. Mostly this labrum gets injured during flexion. This acetabular bone has a two angle, that is an acetabulum anterosion and the second is the central edge angle. Now looking forward, we will be understanding about the distal articulatory surface, that is head of the femur. So it is a round surface with an area known as fovea capitis where there is no cartilage present. So here there are two angles, that is angle of inclination and angle of torsion. So angle of inclination is how much the head is inclined upward and downward, and angle of torsion is how much the head is inclined forward and backward. So first let us look at the angle of inclination. The average value of angle of inclination is 126 degree and it can range from 115 degree to 140 degree. Women have lesser angle due to the wide pelvis. Angle of inclination also decreases with the age due to weight bearing, and the pathological increase in the angle causes coxa valga and decrease in angle called coxa vara. And now going to the angle of torsion, it is the angle formed by the axis passing through the femoral head and the neck and axis passing through the femoral condyle. Angle of torsion decreases with the age. In child, the angle of torsion is almost 40 degree and in adults it is 10 degree to 20 degree. So thank you. This was all about the articulation of the hip joint.